When current medical science has run out of options and doctors don't know where to turn, artificial intelligence might be able to help, particularly when it comes to extreme cases.
It gives me hope.
Medics are getting more and more assistance from computer technology these days. We're not talking about any kind of superpowers, but valuable tools.
We don't want to get rid of specialist eye doctors. We want to empower them. We want to give them better equipment and make them better ophthalmologists who can treat patients more effectively.
They see artificial intelligence as a big opportunity, one that can take medicine into completely new dimensions. But some fear AI.
I can completely understand that AI applications can make people wary.
So what does artificial intelligence mean for medicine? How can it help to improve people's lives? Cornelia Nitzer hasn't been living in this small apartment in northern Berlin for long. The 63-year-old had never imagined that she would move home again until fate turned her family's life upside down. Her daughter Anna Nitzer suffered a stroke shortly after the birth of her second child. Since then, she's been unable to move or communicate. The name of her condition is locked-in syndrome. It has changed everything.
Here you can see how pretty my daughter is. She was pregnant there, you can tell.
Her daughter needs round-the-clock care. Her son-in-law and grandchildren are on their own. Cornelia Nitzer is trying to do what she can to support the young family. It's been 2 years now since that fateful day.
She suffered brain hemorrhaging and a stroke. Someone from the neighborhood said that they must have spent about half an hour resuscitating her in the ambulance.
Cornelia Nitzer is only left with memories. Her daughter, a psychology graduate, was a happy, fun-loving person. Now her family can only guess what she's feeling.
She can't talk. If she moves like this, you can tell something isn't right. But you are helpless. You can't do anything, really.
Several times a week, Cornelia Nitzer helps her son-in-law with the household and with the children, so they at least get a bit of normality.
The children are suffering because they are without a mother. The girl is growing up without a mom.
The couple had just built their own home when Anna had a stroke. Her husband, Nikolai Nikiforov, was suddenly left to deal with everything on his own.
Kolya? Everything's open.
Hello.
Hi there. I'm here now.
The 37-year-old IT specialist often works from home. After his wife's stroke, he tried to care for her at home, but it was too much for him and the children. Nowadays, Anna Nitzer lives in a care home. Her condition and then the separation from her has placed a great strain on them.
The first year was very difficult. In the meantime, we've come to terms with it to some extent. We've got a routine set now. We visit her once or twice a week together.
But in the care home too, communication remains the biggest problem.
I visited Anna on Wednesday. She was quiet at first, but then she started crying. I think she still has bursts of pain.
Her family and nursing care personnel can only guess how Anna Nitzer is feeling. Recognising the needs of locked-in syndrome sufferers and looking after them 24/7 is a strenuous business.
I've tried to work out a code with her that a slow blink stands for yes and 2 blinks for no. But you can't call that proper communication. My biggest wish would be that this were somehow possible again.
The family's hopes are resting on research being carried out at Berlin's Charité Hospital. Nikolai Nikiforov contacted scientists there a few weeks ago.
I came across a video by the professor. I think it was a TEDx talk where he showed what progress was being made in the treatment of stroke patients. My biggest goal would be re-establishing some form of communication.
irgendeinen Kommunikationsweg wieder etablieren könnten?
Making this dream come true is what Professor Zoya Zukada hopes to achieve with his research. The neurotechnology specialist is working on solutions that could help patients like Anna Nitzer to communicate again using artificial intelligence and the communication between brain and computer.
Hello, everybody.
Okay.
Good evening. Good evening. Hi, everyone. Good evening. Thank you very much for joining. We apologize for starting a bit late. It was due to some technical issues, but here we are. Once again, welcome everybody to the day 3 of the Global Health Summit. Thank you for joining us and for staying this far. We are really grateful, and we hope that you've been able to learn one or two things from the previous sessions that we've had in the previous days. Thank you very much once again. This is a wonderful initiative put together by the MAI Foundation, and we are delighted to be doing this with us. We are delighted to have you with us. Yes, and we have prepared for today, day 3. I mean, it is going to be a wonderful, is exceptionally that have been prepared for active sessions that we have prepared for you. I interact well with you. Thank you very much, everybody. And before then, please comment your country, whichever country you are watching this from, you are connecting from. Please comment it in the chat box. I would love to know where you're connected from, your country, and all that you would love to benefit from this segment. Thank you very much. So without wasting much of our time, we have a wonderful guest that has been prepared for us today. She will be leading us, teaching us, educating us on the role of artificial intelligence in healthcare and public health, exploring the benefits and challenges. Yes, she is an associate of the Chartered Institute of the Environmental and Health Safety, recently completed a master's degree in public health at Glasgow Caledonian University in Scotland, United Kingdom. She holds a bachelor's degree in microbiology from the University of Lagos here in Nigeria. Fadekemi is our guest. She is not only an entrepreneur, but also deeply passionate about environmental health and sustainability. I mean, when I told you that we have wonderful, knowledgeable guests in this field for you today, I mean, we came prepared. So without wasting much of our time, please let's make welcome with great delight, Fadekemi Simileoluwa. Thank you very much.
Hi, thank you so much. Thank you so much, Amataya. Thank you very much. Welcome, guys. How are we doing? So I don't know what time you're in, but I'm in the real time for this meeting. So I'm in the evening time here. So I'm talking to you from the United Kingdom in Scotland. And so we're going to be diving into a topic, as Amataya said, the role of artificial intelligence in healthcare and public health. And we're going to be exploring the benefits and the challenges. So I would really, because I like to communicate, I like to have, interactive sessions with people. So I know that a lot of us might be shy or we're just, being humble and we don't want to put on our cameras, we don't want to put on our mics, but I would really like us to respond when I ask questions. Or I would like us to, just interact so that it doesn't look like I'm the only one, in this session. So yeah, I would like to thank my foundation for giving me this privilege, to share this insight on this topic. And I really hope that we would learn a thing or two or more. So if you don't mind, the setting of my room, my table is by the side, so I'm going to be looking back and forth. But it's going to be an interesting session. By God's grace. Yes. So I'll first of all say that digital technology will play a significant role in achieving sustainable human development worldwide. In 2015, the United Nations member states set 17 goals, which we all know as the SDG, the Sustainable Development Goals, to provide a roadmap for the achievement of Earth's peace and human prosperity by 2030, which we all know as the SDG 30 and all. And so SDG 3, as one of the goals, which is aimed at ensuring healthy lives and promoting well-being for all at all ages, will greatly benefit from the implementation of digital technology. With over 1 billion people, Africa can be better positioned to surmount its health challenges, especially regarding maternal and child health and infectious and non-communicable diseases using digital technology, including artificial intelligence. So my question to you is, what is artificial intelligence? I know that we've been hearing this. This is something that has always been coming up, especially recently in conversations. And so the question is, what is artificial intelligence? Artificial intelligence is a software application that simulates context-sensitive response or conversation, for example, in front of a chat with a user in a natural language through messaging applications, websites, mobile app, or via the telephone. AI is defined as the automation of activities associated with human thinking, such as decision making, problem solving, and learning. And from a public health perspective, of course, I'm a public health professional, so we always talk about public health aspects. From a public health perspective, AI can be used to provide health education and health promotion to people in an accessible, cost-efficient, and interactive manner. They can provide automated responses to frequently asked questions, remind people to complete their health screenings, provide educational resources on various health topics. For example, a chat box can provide information on healthy lifestyle behaviors, such as diet and exercise. AI can assist in self-management of chronic illnesses, such as diabetes, hypertension, and asthma. These tools can help people access health services, including screening, diagnosis, and therapy, and provide emotional support to individuals with mental health issues. Additionally, they can be used to track and monitor health data, such as symptoms and treatments, to help prevent the spread of communicable diseases and to provide personalized health advice to individuals. Personalization could be used to remind individuals to get their health screenings or immunization. Additionally, An AI can be trained to provide personalized health advice tailored to a user's medical history, lifestyle, and preferences, which enables the user to access health information and make more informed health decisions. These applications have been validated through multiple studies and are gaining traction in the public health sector. So I know that I've been reading and reading, but I'd just like to, just have conversations because I like us to interact. So I know in a way we're already thinking, okay, artificial intelligence. I know a lot of us might know what this is, but if you know what is really raining now, it's the ChatGPT and all, yeah. So
Yeah.
for example, like the wristwatch I have on, yeah, like this is not the latest version anyways, but I think the latest version that Apple has done is the one that helps you to actually read your heartbeats through electromagnetic and can tell you, oh, maybe somebody's about to have an heart attack or something. That is AI, right? AI helps us to, it's just an advanced way to help us to be informed of in a way that you're living a healthy lifestyle, you're conscious about your health, you're conscious about the health of the public, right? You're conscious about things that are going on around you because in those days there's a way that if you just have symptoms, once you're having headache and you're having colds and you're feeling feverish, everyone just says it's malaria. But now with AI, there are ways that you can go and prompt it, ask questions, and it gives several, list of probably what is wrong with you as relating to what you've asked or what you prompted it to, respond to you.
Yeah.
And so that is a like it just means that the world is advancing, and we as persons we need to advance with the world. Okay, so I'll just continue now. So I'd like us to, I'll just continue by saying, did we know that AI was first used in medicine in the 1970s? Yes. So AI was used in the medicine in the 1970s when medical expert systems based on Bayesian statistics and decision theory diagnosed and recommended treatments for glaucoma and infectious diseases. And the progress in the Bayesian network, artificial neural networks, and hybrid intelligence systems in the late 1990s has scaled up bioinformatics research, thereby expanding uptake of medical artificial intelligence. And so with an increase in global investment in medical artificial intelligence, it is anticipated that AI implementation in healthcare can help save about $150 billion in cost by 2026. Very interesting. And so artificial intelligence has already demonstrated its immense value in transforming healthcare and public health practices. And one of its primary advantages actually lies in its ability to analyze vast amounts of data rapidly, which helps to uncover patterns. And AI algorithm can efficiently sift through medical records, research papers, real-time data to identify patterns, to monitor public health trends, potential outbreaks, and even predict disease trends, thereby aiding in early detection and proactive interventions. Artificial intelligence has already showcased its potential in revolutionizing public health practices and empowering us to respond swiftly to emerging health threats and implement targeted intervention to safeguard our communities. At present, a more meaningful application of AI occur more in developed nations compared to underdeveloped nations. And I'm going to be using Africa. So I'm not just going to be using Nigeria, because we're not just all Nigerians, we're, people from different parts of the world, but I'm an African, so I'm going to dwell on Africa. And so when we compare Africa to other developed continents of the world, AI occurs more in the developed nations than in Africa. And the United Nations in 2 different forums had signaled a need to change this narrative by bringing stakeholders together to discuss how AI can be used to deliver critical public services and help in the journey towards achieving the SDGs. Historically, AI was piloted in Africa in the mid-1980s. It was deployed in Kenya, improved health workers' patient interaction quality with evidence of increased number of symptoms elicited, to improve the detection of common and potentially blinding eye disorder. Medical AI was piloted in Egypt sometime in 1986. And similarly in Gambia, a probabilistic decision-making system assisted rural health workers to identify life-threatening conditions in outpatient clinic. The medical artificial intelligence performed terribly well in detecting 88% of cases. Computerized aids to treat that CATT was also used in drug prescription in South Africa by nurses based on a cost and effective algorithm. In the recent time, the healthcare application of AI in Africa has only seen a few pilot and test cases. So it just simply means that in Africa, looking at how much the level of uneducated population that we have, the number of ignorant and oblivious population that we have, obviously it would result in cases like this, because it just means that there is nothing prompting people to wanting to really advance with time. And really, it's not their fault, because sometimes these resources are not even made available for them in the first place. And so, for example, in South Africa, a multi-normal logistic classifier-based system is being applied to human resource planning, especially to predict how long health workers might stay in public service. A partnership comprising of researchers and social enterprise has been developing an AI planning application for optimizing the scheduling of community health workers in communities in Africa. In Nigeria, Obemwa is a startup that is using signal processing and machine learning to improve the diagnosis of birth asphyxia in low resource settings. Belmore also has conducted studies using AI to diagnose diabetic retinopathy in Zambia, which shows significant and promising results when compared with human assessment. It showed clinical acceptable performance in detecting referable diabetic retinopathy. The Delft Institute software has been developed in piloting studies to examine the use of computer-aided diagnosis of pulmonary tuberculosis from chest radiographs in Tanzania and Zambia. The results are exciting as the performance compared well with that of human experts. Also, pharmaceutical industries have also benefited in the use of AI in Nigeria. A group of 5 high school girls developed an app based on an MIT open source software to identify fake drugs in Nigeria. The stellar idea received recognition in 2018 upon winning a Silicon Valley contest. And earlier in 2019, Adebayo Alonge, a Nigerian trained pharmacist, won the grand prize of Hello Tomorrow Global Challenge 2019 for his AI hyperspectral platform for authentic drug. And so we can see how AI has really, impacted well in the healthcare system and the public health space. And although AI plays a pivotal role in medical image analysis by harnessing deep learning algorithm, it enhances the accuracy of diagnostic processes, enabling early detection of diseases like cancer and other conditions, thus leading to timely and targeted treatment. By analyzing, another significant benefit of AI in healthcare lies in personalized medicine. By analyzing an individual's genetic makeup and lifestyle factors, AI can recommend tailored treatment plans, improving the patient's outcome and reducing adverse effects. And so AI is really good. And let's not forget that we're actually, looking into the benefit of AI as well as the challenges. So we're going to get there very soon. I hope you're following me and I hope it's really making sense. Please, you can always draw me back if you're not understanding what I'm saying. But I really hope that it's been interesting so far, because when I was making my researches as well, I got to realize that AI is much more than we actually see. So AI is revolutionizing drug discovery and development by simulating and analyzing complex molecular interactions. AI expedites the identification of potential drugs, substantially reducing the time and cost associated with the process. However, as we embrace the transformative potential of AI in healthcare, we must also be mindful of the challenges that it presents. Data privacy and security are paramount concern considering the sensitivity of health information. We must establish robust protocols and frameworks to protect patient data while fostering collaboration and data sharing among stakeholders. And to train these robust AI models, we need comprehensive and high quality data from diverse sources. Data fragmentation and incompleteness can lead to a biased conclusion, thereby hindering effective public health decision making. We must foster collaborations to improve data sharing, ensuring our AI models are built on the most reliable and representative information. And so machine learning and precision medicine application requires a training data set for which the outcome variable is known. An important challenge in applying AI for health and medicine is the lack of large clinical data sets for training the AI models. This is especially true for data sets which requires doctors and medical experts annotation, and this can actually be time consuming and very costly. And with the low level of digitization and electronic medical record used across Africa, this is a challenge. This poses as a challenge in generating useful data that are actually important in building this AI system. If you would agree with me, I think there was a particular time where we were having a debate. We're having a debate in our research sometime when I was in school, and we're talking about how the system of African countries, underdeveloped countries actually, do not really encourage the collection of data. So there is no proper classification of data, there's no proper collection of data, there's no proper storage of data. And so because we don't have proper data for setting, health outcome, it actually poses a problem, because you need those data to prompt the AI to be able to produce the desired results that you need. And so because we do not have a proper system in place, it just creates problem because, for example, when there was the outbreak of COVID-19, there was a lockdown, but you will agree with me that in the lockdown, a lot of people did not stay in their homes. And so just in case some people had died because of exposure, there was no proper tracing. There was no proper data. I don't know the word now. There was no proper collection of data to trace the way those individuals died. And so if we have a future outbreak, there is no data that we can fall back to help us follow a particular trend, or to help us to investigate a trend, or the trend at which, oh, this particular outbreak has happened before. And so this actually poses a problem, and this actually also leads to bias, because by the time we do not have proper data, we start to make guesses, make hypotheses. And so if we remember when COVID actually entered Nigeria, they said it was an Italian man, and then they said, oh, there was an Uber driver that took him, or the cement factory. But at the end of the day, a lot of people ended up having COVID. And so there was no proper traceability to actually say, oh, this is how this disease actually entered different regions. And so there is actually bias in prompting the artificial intelligence. And so this is actually a challenge, because when we don't have proper data sets, we don't have complete information that really advance in the public health system. I don't know if we're getting it, but I hope I'm actually carrying you along in this conversation. So let's move on. Like I said, the concept of algorithm bias, which implies that AI is as good as the data on which it is trained on. And this factor, though it's a global factor and not just an African problem, has a more pronounced effect when AI applications are introduced to the African setting, because most AI applications are being developed outside Africa. And most data sets that are available differ from the psychology, the way of thinking of different people. And so while this might not be an issue, it will affect the sensitivity of various cases, because what happens in the United Kingdom, like for example, when we were being told to take the COVID vaccine, we were hearing that, oh, the one that we took in Nigeria is a fake one. and so it just felt like there is whatever that they produced for United Kingdom is not the same quality that Nigeria is getting, and this can actually give a wrong outcome one way or the other. And so there is a need for transparency and explainability in AI algorithms to ensure that decisions that are made by AI systems are understandable and trustworthy. And this is particularly crucial in areas like clinical decision support, where the consequences of AI's recommendation can significantly impact patient care. Ethical considerations are paramount. And this is particularly critical in public health intervention, where transparency fosters trust among stakeholders and facilitates evidence-based policy making. AI must uphold principles of fairness and privacy. As public health professionals, we have a responsibility to ensure that AI applications do not exacerbate existing health disparity or lead to the exclusion of vulnerable populations. we must address the issues of bias in AI algorithms, which can perpetuate health disparities if not properly addressed. Careful consideration of the data used to train AI models and continuous monitoring for bias is essential to ensure equitable and just healthcare outcomes for everybody. Across the world, a lot of countries are just developing a governance policy or legal framework for the implementation of AI in different sectors, which includes the healthcare and public health system. And some countries in Africa do not have the national digital health policy or strategy that will guide the implementation or the monitoring of digital health strategies. African stakeholders also believe that low government engagement at the policy level has stemmed adoption, and a strong engagement will encourage early adoption of AI and digital tools. And so one of the challenges that of AI in healthcare is the fact that, you know, for example, I'm going to say Nigeria because I'm a Nigerian and I grew up most of my life in Nigeria, and I still see what is happening in the Nigerian government. And so because there is no political will of the government towards the healthcare system, there are no proper policy, there are no proper laws, there are no proper guidelines to help in advancing or helping artificial intelligence to be more effective in different sectors, especially the healthcare system. And so these issues have to be addressed. If they're not properly addressed, they continually remain a challenge. And so as much as we want to advance in technology, the government has a vital role to play. The government has a vital role to play because there is a place of the policy and there's also a place of cost. And so the government had to be able to inculcate into the budget some of these things that would actually enhance the growth. And so it says in Africa and around the world, there are no enacted laws guiding who takes responsibility for adverse outcomes that might result from the usage of AI in healthcare, which is highly likely considering how and where AI might be implied in healthcare. The most probable resolution might involve the application of existing laws, but some areas and scenarios are not anticipated or covered by the existing laws, and there will be legal implications for users and patients in African countries. Another major limiting the speed of development of this technology in Africa is inadequate infrastructure, evidenced by low internet penetration and social cultural factors impairing adoption. There is also a widespread of inaccessibility to electricity across the continent. About half of Africans have no access to electricity, and this has made it so difficult to execute and sustain digital approaches in different sectors of the economy, including healthcare. So I just want to talk, because, you know, as much as we're talking about AI, the role of AI in healthcare and public health, if we're talking about health education, if we're talking about making people aware of AI, the benefits, how important it is, how we can help them, the truth is we will always meet these limitations, because there's so many communities that do not have access to electricity. And for communities that have access to electricity, they don't even have constant power supply. And there are still people that are in the low resource areas that do not even have access to telecommunication. They do not have access to proper network. And so this poses a challenge. And this challenge, you know, has to be dealt with, because as the world is growing, as AI is really, helping to improve the lifestyle of people, there's still a lot of people in developing countries, especially Africa as a continent, that do not have access to even the equipment that would help them to access artificial intelligence that would improve their lifestyle. And so this is a challenge that the government or the policymakers have to, come together and tackle. Okay, so it says a USAID report highlights that medical artificial intelligence plays an active role in Africa in the health population, individual care, health system, and the pharmaceuticals and medical technology. This encompasses roles in improving the efficiency of programs ranging from immunizations, logistics, and supply chains, referral services, diagnosis, drug safety, pharmacovigilance, and performance of limited medical procedures. With a worsening shortage of health workers, it is hoped that AI would help complement inadequate human resources through telehealth. Chatbots may minimize hospital visits and assist with triaging before medical consultation. Specially designed AI mobile application require little skills that can help in diagnosing different illnesses, especially malaria in rural areas of Africa, where there is such shortage of skilled health workers and medical equipment. When electronic disease surveillance become more prevalent, AI may be useful in the attenuation of epidemics, particularly in Africa, where disease outbreaks are recurrent. The use of AI in administrative and clinical services can help to save time on routine tasks, such as automation of adjunct activities like writing chat notes, prescribing medication, and ordering tests. Provision of personalized and effective treatments through AI-based analysis of thousands of medical papers or publication would provide improved and up-to-date patient care and reduce operational cost. The rapid pace of AI development necessitates continuous education and training for public health professionals. To harness AI's full potential, we must invest in building the capacity of workforce to effectively utilize and interpret AI outputs, avoiding over-reliance on algorithms without critical evaluation. The integration of AI in public health systems require careful consideration of its impact on existing workflows and structures, if you agree with me. Successful implementation necessitates collaboration between technologists, policymakers, public health experts to ensure seamless integration and maximize AI benefits as a whole. I would recommend that the acceleration of ongoing improvement in Africa's infrastructure, especially electricity and internet penetration. Reliable power supply and affordable internet service would catalyze data generation analysis needed for advanced automation of processes involved in patient care. The widespread use of electronic medical records and large medical databases will foster machine learning that is programmable for Africa. And by increasing the number of data scientists in Africa, a sizable workforce of experts will be made locally available to repurpose already existing AI for medical use. Also, schools and citadels of learning should be adequately funded with more focus on bioinformatics, data science, computational biology, genomics, and applied mathematics. The field may become more attractive to prospective students if graduates of data science and related courses have better work opportunities in the marketplace. It is therefore imperative for private organizations to partner with educational institutions by providing internships before graduation. With smartphone penetration projected to increase by over 100% in Africa over the next 30 years, AI developers need to focus on solutions that can be easily deployed on smartphones rather than personal computers. Smartphones are cheaper, easier to power, more portable for the numbers of health workers across the continent. Governments in African countries need to shun disunity and further cooperate. By furthering cooperation between governments and states, trade and commerce would grow, insecurity will be surmounted, and more resources will be available to create a more robust and digitalized healthcare for the continent. In conclusion, the role of artificial intelligence in public health is always to revolutionize our ability to safeguard communities and improve healthcare outcomes. The role of AI in healthcare and public health is undeniably promising, with numerous benefits ranging from enhanced diagnostics and personalized treatments to streamlined drug discovery. Yet, we must overcome the challenges related to data, ethics, transparency, capacity building, and integration to fully harness its potential. Nonetheless, we must proactively address these challenges to prevent bias in ensuring that AI is a force for good and that it contributes to healthier and a more equitable future for all. So I say, together, let us navigate this exciting journey by leveraging the power of AI to create a healthier and more resilient future for all. By embracing innovation, fostering collaboration, upholding ethical principles, we can ensure that AI becomes an invaluable ally in our pursuit for a better public health outcome. Thank you for your attention. That's me. I hope we enjoyed it. So if you have questions, you can ask me or Motayo. Are we still here? No one is saying anything.
Yes,
That
yes,
was
here.
wonderful. If you have that don't have any question for her, please drop it. You've taken us through this journey. I'm sorry, I want to confirm if you can hear me clearly.
Yes. Yes.
Oh, great. Thank you very much for taking us on this journey, making us see the possibilities and positivity of AI and all of the benefits it has for us. While we anticipate the questions from the audience, I have just one question that I noted down while you were giving your presentation. So you made mention of the ability to analyze vast data. So I've heard quite a number of people make mention that AI is moving so fast, and with the way it is moving so fast, there's a possibility, it is seemingly possible that it takes over human work. I mean, with the way it works efficiently, there's a high possibility that I just want to clarify or ask that, do you think it's, yes, we see that it has many benefits, it has great things ahead of us, what planned for us, yes. So do you think there is a high possibility that it takes over human work, or there is this aspect of human work that AI can't be more clear?
So yeah, you know that it's just like when people start to, when we talk, AI also involves robotics as well. And so as much as we think that AI can take over the jobs of different people, I feel personally that it is people that would prompt AI to work. And so there is a need for collaboration of AI into the workforce, but it shouldn't take over the workforce. I don't think AI can take over the workforce, because as much as it has the ability to do a lot of things, we still need the human intelligence, we still need the human power to be able to prompt it to actually work. But although there is a threat that it might reduce, it might, when you have a brand that employs 1,000 people for different things, there is a threat that, of course, it might actually render people, some like half of the population, jobless. But that is where there needs to be a collaboration with the government for policy making, where there are policies safeguarding or controlling the effect or the impact of AI in every workforce system.
Thank you very much. That was clear and direct. Yes, we await questions from the audience. If you do have any question for her, please leave it in the chat box and we will respond to it. Once again, thank you very much for that wonderful presentation.
Thank you for having me.
Yes, thank you very much. So moving on in this segment, we will be having another knowledgeable guest here tonight, and he will be speaking on the theme. He'll be addressing urgent needs for wellness in the 21st century for underreserved communities. And to lead us, to educate us on this theme is Ahmed Abba Umar. He is a Nigerian youth leader and activist who has dedicated his life to advocating for progress, peace, and youth empowerment. Ahmed Abba Umar here is widely known as the pioneer and founder of the Association for Progressive Nigeria, and he has made contributions to youth development and social country. So while we, as we are going to be having in our midst Ahmed Abba Umar, I would love for you once again to be ready, get prepared, and get ready to accept every of the things you'll be sharing with us with great joy and delight. So with delight, I present to you Ahmed Abba Umar. Thank you very much.
Well, thank you so much. Really appreciate it. I'm very sorry for for the place I am. I can't on my camera. Please forgive me for that. Thank you so much for inviting me to joining you this evening. I stand before you today to address a pressing issue that demand our urgent attention: the needs for willingness in undeserving community in Africa in 21st century. Africa, as we all know that Africa, we are facing significant challenges when it comes to providing adequate health, education, and infrastructure. It is undeserving community. Those community obtain lack of access to clean infrastructure, water, nutrition, food, and proper healthcare facilities, and quality education. This lack of willingness in undeserving community has wider range in consequences affecting individual families and overall development of our dear continents. Without access to basic healthcare services, people suffer from preventable diseases and the higher mortality rates. Limited access to education hinder the potential of young individuals in limiting the opportunities and perpetuity the cycle of poverty. As you can see in Nigeria, I think we have over 19 million out of school children. And in northern part of Nigeria, particularly the state where I came from, we have about 3 million out of school children that are moving from one street to another, begging. But after I make some little research about 2 years ago, I learned that some of those children migrant like Nigerians migrate to Europe, Arab countries. So those people are migrant from our neighboring countries like Niger Republic, Mali, Senegal, Chad, and some other part of Africa. They came to some northern part states like Kano State, and even now I seen them sometime in Nasarawa states. They are begging, no school, no education, no nothing. I believe that it is crucial for us as like-minded youth to recognize the urgency of addressing those issues. We have the power to create change, to uplift and empower those undeserving communities by fostering awareness and advocating for action. We can make a positive impact on the life of millions of people in Africa, in Nigeria and Africa at large. I believe that when education collapses, peace, prosperity, and productive society could never be obtained. First and foremost, we need to raise in awareness about the challenge facing by undeserving communities in Africa. Many people are unaware of the extent of the problems and the need for intervention. We can utilize by using social media platform as we did now, organizing awareness campaign and engaging in dialogue. But as our previous speaker saying that we are facing a serious challenge when it comes to power, electricity, and also when it comes to there is a lot of villages across the country, like in Nigeria and many parts of African countries, they don't have access to electricity. This is a serious challenge. We need to raise in awareness about those challenges facing undeserving community in our dear continents and unaware of the extent of the problems and their needs for the intervention. We can utilize in social media platforms, organizing campaign and engaging in dialogue to shed the light of those issues. The power of education and information cannot be underestimated in creating a collective call to action. Secondly, we must advocate for increasing investment in our communities, because the investment in our community is not only led in governments. We CSO, local CSO and international organizations need collective action, need to allocate resources to improving healthcare facilities, schools infrastructure. By lobbying policy changes and mobilizing support, we can ensure that needs of those community are addressing and the voice are heard. Additionally, we must encourage and support local initiative within the undeserving communities, obtain the most effective solutions, and those development by community members and themselves by providing resource and training. We need more training, we need more action, we need to train ourselves, to train the youths to understand the reality. We need a collective action. We need engagement. Our youths, they really need sports. And since we have the privilege, we need to support our youth. We need to create activities. We need to change the mindset of our youths to believe on themselves, to know that they have something to offer. But the only way we can do this is through education. We can empower our local leaders and entrepreneurs to implement sustainable solutions to the challenge that are facing us. This is not only promote self-sufficiency, but also foster a spirit of right ownership and the community members. Moreover, collaboration is the key. We need collaboration because the only way we can move forward is through collaboration. Is the key and addressing the urgent needs for willingness in undeserving community. As like-minded youths, we must unite our efforts and work together with governments and other organizations and our community's leaders to create change by sharing the best practice, learning from each other experience, and leverage our collective strengths. We can amplify our impact and achieving long-lasting improvements. I believe that when we are coming as one family to tackle this issue, definitely there must be a solution. And I call all of us as a youth leader, please, to using these platforms to call in Africa, especially the current challenge that just coming up in the Sahel region, in Niger, in Mali, in Senegal, in Niger, in Mali, in Burkina Faso, and even here in Nigeria and many African continents. We need to speak to our leaders, to raising awareness to our leaders, to using a diplomatic way to solve this issue, the current issue that is happening in Niger Republic. Because if we're using force, if the ECOWAS using force to enforce this coup d'etat army in Niger Republic, definitely there must be a serious catastrophe. Because as we can learn, our West African countries, we are facing uncountable numbers of insecurity, from Boko Haram to kidnapping to ISIS to Al Qaeda, and most of the even in Libya, what is happening in Libya, most of the weapons that come into Nigeria and some parts of our neighboring countries, they come directly from through Niger. So when this issue escalates, definitely those criminals, they have access to weapons and they can create more catastrophe. And our local community, our vulnerable communities, they are facing, even now there is serious hunger in the entire African continent, not even because of rising inflation. So we need to take serious action. We need to call our governments, our policy makers to know the consequences of using force. Please let us use in diplomatic way to solve our challenges. In conclusion, the urgent needs for willingness in undeserving communities in Africa cannot be ignored. It is up to us, the youth of today, to take action and strive for more equitable and prosperous future by raising awareness, advocating for investments, supporting local initiative, and fostering collaboration. We can make differences in the life of countless individuals. I believe that together, let us stand up for the rights of undeserving community and work toward a brighter future for Africa. In conclusion, I believe that obtaining quality education is the foundation of sustainable development. When education collapses, peace, prosperous, and productive society could never be obtained. Thank you so much for giving me this opportunity to speak to you at this night. I really, really appreciate, and I look forward to work and cooperate with you. Thank you once again.
Wow, wonderful, wonderful session. Thank you very much, Ahmed. That was a wonderful charge from you, and thank you for bringing to our knowledge all that we need to know and educating us on all that you've spoken about. That was wonderful. Thank you very much. Really, really insightful. Please, if you have question again, you should please leave it to the chat box. We will address your question. Thank you very much. Once again, thank you very much, Ahmed. Now, in this session, in this segment, we are taking on something really, really insightful. We are moving on to something really educating and wonderful, pleasing to your ears, I tell you. And this is the Global Health Promotion and Education Fair. And this fair is a space to share ideas and best youth-led practices on how to achieve good and well-being through health promotion, education, and awareness. And joining me in this segment is no other than Dr. Diela. She will be pitching, she's pitching a project and that she wants to carry out in our region, and she will be here to talk to us about it, discuss it, and we hope that we learn one or two things. So yes, Dr. Diela Monzero, I don't know if I got the pronunciation right correctly. We are ready to hear all you have for us tonight. Thank you very much. Can she, Dr. Diela, are you there? I don't know if you can hear me.
Hello?
Okay.
Hello?
Yes. Yes, we can hear
Hello?
you. Thank you.
Okay, hello everyone. I think you can hear me. I'm sorry for the place where I am. I can give you all the video, but I think I can present all my project, summarize it in few minutes. Is okay, I think. Okay. So my name is Dr. Diela Munezero. I'm from Burundi. I am a general practitioner, a medical doctor in my country. So as we are talking about underserved communities, I am with a group of children, of people with sickle cell in Burundi, especially in in the rural province of Burundi. So I've come up with a small solution, which is a program for enhanced the quality of life for the person of sickle cell disease. It is called the Repacare program, and it will in my community is a general doctor. So the sickle cell disease is a very burden in the families with sickle cell disease patients. So, as a small reminding, sickle cell disease is the first genetic and hereditary blood disease characterized by chronic anemia, chronic pain, organ damage, and early mortality. So, in different countries, like in world, sickle cell disease is becoming a large number because it's estimated by the World Health Organization in 2016 about 2% of the population, and it's called also about 10% to 40% of persons will carry the gene of sickle cell disease. So in my country, especially in my hospital when I work, Amahoro Vidimba Hospital, I found that in pediatrics, 5% of all the children with sickle cell disease. You can see that it's a very large number. So it's a very burden of sickle cell disease in Rumonge because there is lack of follow-up, and that lack of follow-up is due to poverty, different stereotypes, and ignorance. So I've been working with these children because there is many children who are suffering from sickle cell disease. Among them, don't reach 14 years. Do you imagine a young girl with different complications, pain, anemia, and so on? But they are suffering. They can't reach age of 14, or it's a very big situation for the families. Among them, they are very poor. They can do regular checkup, and so they get a different complication early. So the mortality is very big at the small age of these children. So how might we ensure that sickle cell disease in Lumonge province would have the appropriate care they need? Because how might we? I have like a question. Or my 2 years, I think, because I start my program with there is almost 3 years. So I've come up with a solution, which is the Repa Care program. It will be a program to enhance the quality of life for those who live with sickle cell disease and their families in Rumonge province. So it will raise awareness and education about sickle cell disease within the hospital to healthcare professionals, sickle cell disease families through the evening sessions. It will also empower and help psychologically the vulnerable families, and also it's advocacy for healthcare coverage of sickle cell disease patients. So it will work through the hospital, will reach communities, health workers, and different leaders to reach the population with sickle cell disease. And so they will come in the hospital, they will do regular checkup, will transmit for them to come to do regular checkup, give them different medication or take care efficacy for the different patients. So and we think this will come with a proposition, which is an improved quality of life, because the follow-up program will ensure that individuals with sickle cell disease in Rumonge province will receive regular care. And also this homes, and also complication, and promote overall well-being of these persons. We will need the different stakeholders, because even if the Ministry of Health don't do anything for these children, and there is no other governmental organization for helping these children. So we need different stakeholders like UNICEF, every NGOs who will help us to take care of these children, because as you have seen, it's a large number of small young who don't have the chance or the ability to grow and do different things. It's a very bad situation in our country. We need also to gain some we have created a budgeting. So we need to begin with something. We need different we need computers, we will need some
Okay, so sorry about that disruption. I'm sorry, I had technical issues. So thank you very much, Dr. Diela. Thank you for making us see and understand all of these things. Thank you for pitching that idea. Thank you for thank you for this wonderful initiative of yours. We want to see work. We are ready to see it take action, and we hope that you excel exceedingly. Amen. Thank you very much. So,
Thank you.
people, we are almost there. We are almost there. We've had wonderful talks and insightful ones from different guests tonight. We have from Dr. Diela, we've had from Ahmed, we've had from the first speaker. I'm sorry, I'm forgetting her name right now. And I must say, we can all testify to you that we are almost there. We have gained a lot, and that's just the tip of the iceberg. So now, before, without wasting much of our time, we will be having one of our guests that we're supposed to have, I think, yesterday or day before yesterday, and he'll be educating us. He'll be speaking on the topic innovations in telemedicine for health promotions, innovation in telemedicine for health promotions, and that is enhancing access to healthcare in remote areas. So ladies and gentlemen, joining us here tonight, enlightening us on this topic is Dr. Fashoroti from Nigeria. Thank you very much.
Good evening once again. Can you hear me?
Yes, we can. We can hear you, sir. Thank you.
All right. My name once again is Dr. Fashoroti Afolabi. Apologies for not joining last time because I was having a network issues. And I've also been waiting since morning. I thought initially it's going to be 7, but unfortunately, I was asked to join by 8:30. Currently in the train, but I'll try to do what I can do within the limited time. Let me just start straight away. My topic is telemedicine, innovation in telemedicine for health promotion, enhancing access to healthcare in remote areas in Nigeria. First of all, I would say that avoidable deaths in Nigeria are deaths that have been prevented through proper health care, public health intervention, and timely access to medical services. And common causes of avoidable deaths in Nigeria include, I'm so sorry for what is currently happening. It's just that we can't shift again so that I won't cause another disruption in the activity. Apologies. So the reason why I started with avoidable deaths is because we still have an incident that happened in Nigeria the day before yesterday, where there has been signal about the lift in medical facilities in Nigeria. And unfortunately, the doctor died in the process. So all those things are caused as a result of negligence. So we have a lot of people dying from maternal mortality. We have a lot of people dying from tuberculosis. We have a lot of people dying from malaria. We have a lot of people dying from HIV/AIDS and the likes. So this is 21st century, and we still have this issue of unavoidable deaths, or avoidable deaths rather. So the essence of telemedicine globally is to bridge these avoidable deaths. And that's the reason why we have innovation in health technology. And telemedicine is the use of technology to provide healthcare services remotely. And it is gaining momentum worldwide as an effective solution to bridge healthcare access, especially in remote and undeserved areas. And we have the cases of Nigeria. So a country with diverse geographical challenges and limited healthcare infrastructure, telemedicine innovation holds significant potential to enhance access to healthcare and promote overall health and well-being. So the essence of telemedicine is to bridge the gap between infrastructural deficits, whether in any country, whether in Nigeria as the case may be. So in 2020, World Health Organization referred to telemedicine as a remote delivery of healthcare services using communication technologies such as video conferencing, mobile apps, and remote patient monitoring devices. For example, while I was doing my thesis in 2017, I made use of telemedicine to deliver healthcare access to tuberculosis patients. For example, one of the reasons why we see a high prevalence of tuberculosis in Nigeria is because of late presentation of patients to hospital, and also deny the fact that they have this disease condition. For example, a lot of people find the habit of going to churches, going to mosque, and when they get tested in the hospital, they live in denial, telling themselves, God forbid, I don't have this. So by the time they get to the later stage of these diseases, then you find out that it is too late to control or contain it. So the reason I developed an app, and the app is the app is designed in such a way that it can prompt people to use their medication. Because one problem about tuberculosis is that if you don't use your medicine, there's going to be relapse, and all of a sudden you start from day one again. And reason why people don't use their medicine is because they forget sometimes to use their drugs. And once they forget, there's always a tuberculosis relapse in the body, and which is more deadlier than the initial stage of tuberculosis. So we found out that after we have developed that medical app, anytime they want to use their drug, it prompts them to use their drug. And we found out that people that use that app have better recovery rates than people that doesn't have access to the app. So these are some of the innovation that telemedicine is bringing to the world of health promotion in the world. So to run, because you said I have 20 minutes, so I will just run through what are the forms of telemedicine. We have synchronous telemedicine. It is also known as real-time medicine, real-time telemedicine. It enables immediate communication and interaction between patients and healthcare providers. It involves video conferencing, live chat, or phone call. In terms of synchronized telemedicine, it's such a situation whereby you can call your GP or your medical doctor, and it will be giving you information directly. As the thing is happening, it's providing an information on what you need to do. Let me cite an example. Just last week, a friend of mine in the United States, his wife entered into labor, and it was just at the dead of the night. So for them to get the medical personnel to come, or for him to transfer or transport his wife to the hospital, time is running. So what they did was that they put a video call between my friend and the GP. And the GP was giving him information, do this, do this, do this. And thank God, my friend was able to deliver the baby successfully before the doctor arrived. So these are synchronous message of televising telemedicine to the people involved. For example, if there is an emergency or an accident happening and there are no first aider or a medical personnel in that area, you can go into video conferencing and doctor will be telling you the necessary things to do, such as how to transport people that have medical emergency. This is a synchronous method of telemedicine. We also have asynchronous telemedicine, which is a store and a forwarded telemedicine. It involves transmission of medical data and information. For example, during the Ebola crisis, we start having a lot of information passing on what you need to do to prevent Ebola. So all those messages going around through social media is also another form of the telemedicine, which is the asynchronous. So it's a recorded message. If you go to YouTube and you start listening or watching video by medical experts, then that's asynchronous telemedicine. And what are the innovation in telemedicine for health promotion? Telecommunication for chronic diseases, e-health, record and telepharmacy. We also have artificial intelligence in telemedicine. So what are the benefits of telemedicine? Benefit of telemedicine, one, it helps to enhance healthcare access. It breaks geographical barriers. It enables patients in remote regions to access medical consultation. Then we also have cost. Can you hear me?
Yes, I can, sir.
Hello?
Yes, we can.
Hello?
Yes, we can.
Hello?
Yes, we can. Yes. Okay. Well, unfortunately, I think okay, this session is over. I don't know if you still get to join us, but thank you, Dr. Fashorati. I hope we're able to understand a thing or two and can remember and have jotted down all that he has said and can, yes, thank you very much. So to conclude this summit, to conclude this session, we'll be having the founder of the MAI Foundation himself to come talk to us tonight. He will be okay, I'm sorry. So I said we'll be having the founder, the CEO of MAI Foundation here with us tonight, and he will be discussing the future of healthcare, that is emerging technologies and trends shaping the industry. This will be our concluding session for this summit, and I hope that as you have enjoyed the previous ones, you will enjoy this one that we have for you. So ladies and gentlemen, join me as I invite here to our midst Ayomide Marvelous Iwalai. Thank you very much.
Hello, everyone. Good evening, or good afternoon, or good morning, whatever time you're joining. I think Dr. Fash is going to join us soon because he just sent a message that he's going to rejoin soon. So, can we just wait for that?
Okay. So while we wait for Dr. Fash to join us, for those that joined us in between the session, I'm just going to have a quick rundown on everything we have been talking about. So firstly, we had Fadekemi Simile Oluwa come. We had Fadekemi Simile Oluwa come talk to us on the role of artificial intelligence in healthcare and public health. While after that, we had Ahmed Abba as he spoke on the. Please hold. I'm sorry. Yes, we had Ahmed Abba address urgent needs for wellness in 21st century for under-reserved communities. And we have currently, as we are waiting for him, Dr. Fash, as he will be speaking on innovations in telemedicine for health promotion, enhancing access to healthcare in remote areas. So please pardon us as we wait for Dr. Fash to join us. He is currently experiencing a little issue and he will join us soon. He's currently in the train and might not find it easy to address us. So please bear with us as we wait for him. Thank you very much.
Hello everyone. So it might take a little bit of time before he joins us. So I do just want us to be hanging before he joins. So thank God for day 3 of this summit, and glory to God for the speakers. Though for day 2 we had some kind of issues with the speakers and their family and studies, so they were unable to speak on the second day. But we had a session on the first day, and today is the last day till next year. So we thank everyone for joining in, and over the streaming platforms also, we are also with you over YouTube and LinkedIn. All right, so I guess you'll be joining us soon. If not, I'll just continue. So let me just discuss about what the summit, because I'm seeing some people are just joining for the first time. So the summit is is composed of, or it was organized by youths from different countries, and we had speakers from over 5 to 6 countries, and we had a global health challenge where the winner will be announced immediately after the summit. That's few days. And we have the Global Health Promotion Fair champion from Burundi, which she spoke a few minutes ago about our intervention in our country. And so far, we had over 1,000 people that registered from over 20 countries. And we've been monitoring the attendance also, the participants. We don't know what's wrong, but we hope next year is better with the kind of people that registered. So I just think I will go straight before he comes in. I don't want us to interrupt each other. All right, so I'll be speaking on the future of healthcare, the emerging trends in healthcare and public health. So first, I would like to make this known to us that the future of healthcare is generally in our hands. The future of healthcare is generally in our hands, and with the daily rise, just like we had the first session on artificial intelligence and how they can be incorporated to the healthcare system, and now they are meant to serve as a support, not a substitute. So it's generally in our hands, and we are the one that decides. There's no healthcare without humans. There's no AI also. There's no artificial intelligence without humans. So we are still the determinant of everything that happens. So, and since this summit is focused on underserved communities, so there will definitely be a gap in the future of healthcare that by 2030, 2040, just like how there is currently a gap between the primary healthcare system and the universal healthcare system, the ones for developed countries and third world countries. There's a very wide gap. So we need to bridge that gap. And those people that can bridge the gap are the youth, both children and youth organizations. Majorly for Africa, forget about government. Government has failed over and over and over again. We youth need to step out, make moves, set up interventions, innovations to solve problems in Africa generally, and all those other small island countries also. So overall, the last few decades, globalization and aging population, the rise of chronic illnesses, and changing demographic has reshaped how we think about healthcare. Because on the global population, 8 billion, it keeps increasing. And definitely that 8 billion is not all the populace of the earth. It keeps increasing every day. And there are a lot of behaviors people act, which just like those are the determinant of health and those are the determinant of diseases. We are still going to that. So healthcare solutions that reduce public health threats and prioritize wellness these are the three major people that are vulnerable. Since we are focused on vulnerable communities and vulnerable people, the aged ones, that's the elder care, the elderly, the children, and women, they are mostly vulnerable to infections and diseases and all sorts of casualties related to health. And also, they also experience health disparities, non equal attention or non-equal healthcare services given to them. So research has made clear that the healthcare system will continue to evolve in response to all of these challenges, and definitely the pressure of costs is there. There's also increasing costs. There's inflation. I think I read a few times or few months ago that the inflation happening in the top world countries like China and US and Canada, the African countries which and the small island countries which they're not just doing anything, the inflation will also affect them, because that is where most of what our, let's say, the lifeline are just hanging on the top world countries. So the way inflation is increasing in those top world countries is also going to affect, though they are not living in those countries. So there will be increasing costs for healthcare services, increasing numbers of uninsured. In Nigeria, in most Africa, there's nothing like health insurance, but in US, in Canada, in UK, there's definitely health insurance for almost everybody. So, and they are able to take care of them to an extent. But that's why I said earlier that the youth in Africa, they need to step up. They need to create innovative ideas to solve healthcare problems. So 10 trends for the next decade are evident. There will be more patients, there will be more technology to serve as support, not replacement. There will be more information, like the first speaker stated, about data collection, all of that. There will be more information. There will be patients with ultimate consumer. There will be development and delivery of models and AI. 10 years, 20 years to come, just like how we have the SDG 2030. It's part of the goals for SDG 3, good health and well-being. All of this are part of it. So there will be innovative driven by competition, just like how we have the United Nations Young Goal, where there are a lot of global youths, which I'm privileged to be a part of, and they are contributing a lot towards climate change. There's also another constituency of health, which also they are creating. So majorly the Africa and the low income developing countries and the small island, they are majorly left behind. They are the global south. They are majorly left behind far from the global north. So we need to step up. We can see some people going out. What we have to do is go out there, get all of those exposure, get all of those experience, those big tech, and bring it back to our country, and not just to stay there and just, like the word they say, jack back. So we have to come back and reorganize our country and make all of this right. So there will be also increasing numbers of uninsured, just like I mentioned. Generally in African country, I don't even think 90% are insured. They have health insurance. Talk more of their car insurance. So to begin with, health promotion and education is very necessary. It's very important. That's like the bedrock, even for this is applicable to all levels, starting from the basic educational foundation. That's for the the school children at the primary level, secondary level, the high school level. So health promotion and health education is very necessary for the future of healthcare, because if before these people grow up and begin to develop health issues and genetic deformities and all of that, and health behaviors, we can tackle it while they are still very young. We can teach them health instructions. We can give them health informations on how to do this, on how to do that, basic hygiene, safe practices, and all of that, so that those occurrences so that those occurrences of health challenges will not come up in the future. So the source is health promotion and health education. From the very source, tackle the source before the problem escalates. So just like how we have the determinants of health and the determinants of disease in comparison, the social and environment factor, the economic factor, climate change, and all of that, there are different kind of education we can give the young people about climate change, about the health and social, how they can take healthy practices, how they can be hygienic, and all of that. So individual behaviors and characteristics, how smoking is bad, is injurious to the lungs and all of that, how personal hygiene is necessary, how taking, just like how we had in day one, a video about junk food, and junk food can clog your bloodstream, and sugar is even more addictive than cannabis and marijuana. So just like how we watched the documentary on day one, so we need to give all of this information out to the public, especially the children, right from the source before they grow up. And so this is called the primordial prevention strategy, disease prevention strategy. So right from the source, we tackle it. So the concept of people's lives determines their health, and so blaming individuals for having poor health and crediting them for good is improper. So individuals are unlikely to be able to directly control many of the determinants of health, but health promotion and education is needed to enlighten about risk factors, because risk factors are like what can predispose them to all of those issues. So highlighting them on risk factors and how they can be how they are predisposed if they do certain things, if they eat certain food, if they associate with certain things, how it can bring up either genetic or on its own an ideal health issue. So apart from, just like I mentioned, the determinants of health and determinant of disease, of income, of social statuses, of education, of climate change, of genetics, pattern from the lineage and all of that, and addressing all of those issues and all of these determinants, there's a basic factor also we can introduce in digital learning, because this is the future of healthcare, and technology is on the rise also. Technology is gaining speed as almost everybody's. The future is technology, and like I mentioned earlier, is to support, not to replace. So digital learning can come in beneficial for this concept of health promotion and health education. Digital learning, either through our social media or through channels for, so just like how we are able to reach each other through this World Health Summit from around the world at the same time. So digital learning can even help us increase our reach. So no, we are not just limited to our region or our state or our country. So digital learning can help us. So in addressing the future of healthcare, digital learning in association with health promotion and health promotion and health education is necessary. And this is a definitely individual actions. It's not your school that can educate. Individual actions. I'm definitely sure most of us on this call are health students or health experts or health practitioners. So we can give those informations out through our social networks, through we can, just like how the May Foundation is still planning on getting a website to educate millions by the end of this year. So everyone, individual actions is very necessary, just like climate action for good health and well-being. Now I'm going to the next thing is strategic partnership and collaboration. The future of healthcare is an emerging technology is on partnerships and collaboration, especially if we want to solve the challenges of underserved communities and vulnerable communities. Strategic partnership, just like I mentioned earlier, that there's a global network of climate change youth activists. Just like that, there's an SDG 3 good health and well-being global network of youth activists and youth organizations. So, and just like how Ahmed is one of the Ahmed is one of the subordinates from the climate change organization. So just like that, and he was able to present his own quota to this summit. So just like that, strategic partnership and collaboration is very necessary. And also this also is an individual action. We need to get involved with the professional health network in our region. Every professional health network in your region, in your state, in your country, you are needed to be involved so that you can make this impact and solve all of these issues. So we have also the changes in healthcare delivery. So the future of, just like apart from teaching and impacting informations to little children, the training of tomorrow healthcare professionals is very key. It's very key. The training of health students, the training of MBBS students, medical practitioner students, medical or health service students, social work students, everything just associated with healthcare. The training of these professionals are very key, and that's the future of healthcare. Training of these healthcare professionals, right from their university level to the master's to PhD and to wherever height they still want to further. So the training, quality education and quality experience for these people is key if we are to achieve universal health coverage, just like how the SDG 30 is pursuing. So also, apart from that, that's on a global scale. Apart from that, we need to have more focused primary health care in local communities. This is specifically for the government, but also there's a project going on where we are not waiting for the government again also for primary health care, because specifically in Africa, just like I mentioned, government has done what they can do and they are doing whatever they can do. But primary health care, currently, our partnership with some organizations and even WHO, the Partnership for Maternal, Newborn and Child Health, and in few years' time, we are planning to have like a free medical, not outreach, like free medical system within, we are starting with Nigeria first, a free medical system within Nigeria with the WHO, a free medical system with the government also, because this is when we are at the forefront of this. That is when the government will start looking for us to sponsor or to support or to be a part of it. But for them to start the project take a lot of time. So we need to get out there and do all of this. So this is just one of those things that the organization is part of concerning the future of healthcare. So the next thing is youth engagement. I've been mentioning this from the beginning. Youth engagement, involvement in structuring the healthcare system is necessary for low-income and developing countries, for small island countries. Youth engagement and involvement is the future of healthcare, not the grandpas and the grandmas in those seats there. Is youth engagement, youth involvement in policies of healthcare, healthcare policies, in healthcare decision making, of from the basic level, from the local level, to the state, to the federal. Youth engagement and involvement is very necessary, even to the implementation. Is even when the youth are engaged and involved, there will be a speedy result and a speedy result of all of the plans. So finally, we have the rise of precision medicine. The speaker from day one mentioned this. The future of healthcare is on precision medicine also, where there will be a personalized health service, not a general one, just like how the other speaker also for today mentioned, where there was a generalized, everyone, when you are sick, they'll think everything is malaria. But now there's a rise in precision medicine where there's a personalized or a customized health service is according to what. So through all of the tests with the help of AI, it will find out what is actually wrong with you, find out what is the issue, what is the solution, what is all of that, and it will give all of those data to the next health health practitioner to solve those problems. So there's a rise in precision medicine, a personalized and individualized health services. So in the next 3 decades, that will be majorly the future of healthcare, where there is a specific health service for this person, a specific health service for this person, where everyone is not just treated the same way, but a specific health service for individuals, and this will be able to this solution will be able to target specific diseases, because most time when they say that there's a similarity, they can just classify everybody as one disease. But if they go deeper, which AI is almost doing that, if they go deeper, they will find out that there's a difference in all of these diseases affecting one or the other. So most of these cases of just generalizing has caused a lot of damages in healthcare services. We just generalize that it is so that is happening. No, you have to find out, and AI is making that easier. So to predict how individual will respond to various treatments has revolutionized healthcare and healthcare professionals. So I think that's all for World Health Summit 2023. And I want us finally to remember that our advocacy does not end when we turn off our computer or our smartphone. Within our region, let us get collaboration and partnership with the health network within your region. Let us get the word out. Let us be involved in public health promotion, public health awareness programs, because this is the only way we can achieve the universal health coverage, not depending on the government. The government is on their own. Let us do this. Then the government will see that we are really serious. Then they get involved. So let's refocus to the basics: health promotion and education. Health promotion and education, engaging and involving the younger generation. That is the future of healthcare. And specifically for Nigeria, from August to December, the May Foundation team in Nigeria will be going to different high schools and different schools in Nigeria for the SDGs promotion. All right, so thank you very much from YouTube, from LinkedIn. wherever streaming channel. Thank you for joining today. Thank you for joining us. Do we have any question? Do we have any question? All right, thank you very much for joining in. There's also an added benefit to being a part of this. There'll be a certificate of participation to all attendees. They were really present. And thank you to the May Foundation team for the support and all of the innovative ideas and all of that. And thank you for everyone joining in. I guess we see everyone next year, and next year is physical. And let me hint everybody on this call. Next year might be physically in London. So I hope to see everyone there. Have a good night, or have a good evening or day, whatever time zone. Bye-bye.